We're going to open up this for the next 15-20 minutes so you can ask questions about mental health, pain and fatigue, staying active, and eating healthy. So if anyone has a question, we will be the first volunteer. Any questions from anyone?
So as someone with ECD and a bunch of other stuff, and about to turn 70, I'm trying to figure out, I get all the exercise that's recommended. I'm not always happy with the progress. And so what I can't figure out is how much, is there a way to triangulate between my various health conditions as you know, limits as how good shape I can get in, vis-a-vis my age, because I know the age is a factor, but I just don't know what I can reasonably expect to attain given everything that I've been through.
So by age, we need that we are longer in age, muscle is going to lose. So it's a sarcopenia, the name, the technical name. This is physiological. But muscle needs to have something to eat, and the only that muscle needs is movement, it's exercise. They need protein, of course, but if you are eating protein and if you are not doing any movement, doesn't work. So probably water, exercise, walking, and standing up exercise, especially neck, shoulders, hips, and legs. And you can do lots of things sitting in a chair and going with elastic bands with normal weight, which is your arm and maybe 200 grams. And probably you need to exercise this kind of exercise probably at least 3 times a week. At the WHO, it's the recommendation. And it depends on the fatigue, and it depends on the pain. You can go up progressively. So increase intensity, increase time, and increase the time that is the exercise, the exercise. I don't know.
I'd like to add that I talked mostly about protein before, but I also mentioned complex carbohydrates. They are good for fuel. Yes. You also need them in order to do a proper exercise.
Oui, bonjour. Ma question, je vais la poser en français. Je vais laisser le temps de traduire. Est-ce que vous pouvez me donner la différence entre le café et le thé et thé vert, thé noir? Qu'est-ce qui est le mieux de boire régulièrement? Merci.
Well, he was asking about the difference between coffee and tea, green tea, or different kinds of tea. All of them have caffeine. When I was a kid, people talk about theine instead of caffeine, but later I found out that it's the same. It's a matter of concentration. The concentration of caffeine is higher in coffee. Usually it's higher in coffee than in tea. But there's also, it's an interesting question because there are lots of different plant-based compounds, and they all have their different anti-inflammatory properties, both in tea and in the different kinds of teas, and also in coffee, because the effect, and it also has some importance in it could also be important in the microbiome, which I just mentioned, because we had a very little time, but it's a part of the medicine of the future and partly in the present, that helps to individualize treatments to everybody. So there's, for example, coffee, regular coffee or decaffeinated coffee, they do a lot of effects independently of the caffeine content. And for example, coffee has proved benefits in after gastrointestinal surgery. It helps it helps the bowels regain their movement and reducing the risk of post-surgical obstructions or complications. So, well, I think, going back to the question, I think that, in my opinion, different kinds of tea and coffee, they are part of a good, healthy diet, and they can also be helpful in keeping your concentration. And they can also be part, I really like coffee and I really like tea, and it can also be part of a happy life. I mean, you drink them for pleasure. It's part here I'd say in Spain or in Mediterranean countries, it's a very social thing to meeting for coffee. And that's part of an enjoyable life, which we all aspire to have. And you should take care of the effect that caffeine does to your body. You don't want to keep yourself awake for a long time. And usually mobile phones and screens help you to do that. If you have coffee or caffeine content later in the day, it may help you stay awake, look into your mobile phone or watch TV, and help you keep awake for a longer time, reducing the quality of your sleep. And they also talked about the importance of sleep. And that's something that needs to be taken into account.
What would your recommendation be for the daily intake of protein and the different types of protein, whether it's red meat, white meat, or fish?
It should be at least 1 or 1.2 grams per kilograms of weight a day, at least, unless you have pre-hemodialysis renal insufficiency. In those cases, you should limit it to 0.6, 0.8. That means if you are 80 kilograms heavy, you should have at least 80 and probably a bit more grams of protein a day. And mostly if you are, as she's mentioned before, sarcopenia is a really important issue. And with age, you need to have the threshold of muscle synthesis after eating gets higher, meaning that you need to eat more protein as you get older in order to maintain your muscle mass. So after 70, maybe it's better if you aim for 1.3, 1.5. That's a lot of protein. And usually it goes with an aging person which may have more symptoms of any disease that the patient has, not only Erdheim-Chester. And sometimes it's difficult to achieve, and I think that's one of the reasons, added to sedentarism, to the growth of sarcopenia, and it should be a very important medical concern.
Just to clarify, that's the daily intake, not per meal.
Daily intake, yes. Yes, and at least you should have, per meal, at least 25-30 grams of protein in every meal. And as you get older, maybe you have to reach the threshold I was talking about. It could be up to 40 grams a meal. If you eat a little bit of protein and you don't get that threshold, maybe you don't stimulate the muscle synthesis. And that could be an issue. That's also important. One of the points I mentioned in my presentation was the need of supplements, not just of calcium and vitamin D or iron or whatever, or probiotics or anti-inflammatory fats or omega-3 fats, but also of protein or protein supplementation, mostly if you are at the hospital or if you're to have a scheduled surgery.
I just want to add to that. You mentioned, sir, that animal protein, fish and chicken and fish and things like that. Let's remember that protein can come from vegetable sources too, for people who are not tolerant of any animal products. So think about your legumes, leafy vegetables or greens that are high in protein. That's a good option. The quantity might be larger to get these requirements, but it's not animal, the only source for protein, just to keep that in mind.
Yeah, I agree. It's true that you mentioned that, and I started talking, and I forgot to answer that, but I agree with what he said. I mean, you mean you talk about supplementing vitamin D? I think that trials of giving it to everybody have not showed consistent results. That it should be given to everybody. If you don't have a deficit, probably you don't have to have it. And mostly, excuse me, mostly here in Mediterranean countries, there's also a lot of deficit, but it's not as high as in other northern countries. And in my opinion, in risk populations, the levels of vitamin D should be measured. And me as an endocrinologist, I like to measure them with the PTH, the parathyroid, the hormone, to see if there's, to help determine if there's a deficit. And if you have a deficit, you should certainly treat it, but I'm not that sure about treating it for everybody.
You talked about sport, diet, and mental health, as well as the people around you. I garden for sport. Plant hold no secret for me, as well as a Mediterranean diet. I'll be incorporating blue fish in particular. The biggest problem is being able to persuade your wife. As far as coffee is concerned, chicory is better. Plus, it contains insulin.
Sorry, I didn't understand quite well, and the translator, neither did the translator, I'm sorry. You said that you had trouble convincing your wife about eating fish or drinking coffee.
I practice sport. I practice sport. I can also plants. I wish eat blue fish, but my wife is need to buy. Can you change me to have my wife have ECD?
Well, I think it's also up to everybody's liking or disliking, and maybe she hasn't. Well, there are different alternatives, as he also mentioned before. You can have high quality protein from other sources, and maybe she doesn't want it for herself, but maybe for you she does, or she may have it for you, but well, I think that's why it's important to individualize and to refer to the specialist to help give tailor-made consult to everybody, because it's not the same general recommendations for everybody, and I think that's part of the problem of medical nutrition, is that sometimes for so long we've been working with one-size-fits-all measures or regimes, And it's much more difficult and time demanding for you to adapt to the situation of each patient. And you have to spend a lot of time in the consultation, speaking to the patients to know what the patient, his family, likes or dislikes, and adapting to it. And also, there's a problem with the lack of randomized clinical trials regarding nutrition and comparing people with Erdheim-Chester disease, which are so rare, they're so few in number, comparing those who eat fish or those who don't. There's not, as far as I know, there's not that trial has not been made, and that should be very difficult to be made. So it's difficult for us, medical and scientific professionals, to give an advice based on that, but there are also many other things or ways to know what is best or what is worse for patients.
Alice has a question.
I have to say something about exercise because, as you know, exercise is my second medicine, and I do a lot of cardiovascular exercise. How come I cannot get my heart rate up? Is it the disease or medicine? Does anybody know?
Okay, that's a very interesting question. Probably it's about the effect of negative chronotropic situation, about the side effect of the pharmacology. There are lots of pharmacs, there are lots of therapies that they stop the frecuencia cardíaca, heart rate, I'm sorry. And then you need to train, and you use the two tests that I told before, which is the scale board, RPE, and the talking test.
Okay, I don't have a question, but I'm just curious about what you think about alternative medicine and things like that for Erdheim-Chester disease, for pain and fatigue. We always think about exercise, that we have to go to the gym or do something else, but any thoughts about movement therapy, dance therapy, myofascial release, massages, things like that that can help patients? Acupuncture, for example. We had minimal experience with that in the United States, and those patients really benefited from that approach instead of the mainstream approach. Have you had any experience with that, or anything that you think can be trickled down to the Erdheim-Chester disease world?
In pain, I reviewed that article about integrative medicine, and it seemed that acupuncture and massage could be a good approach to treat pain. And in fatigue, ginseng also had enough evidence to be recommended. And some other Chinese medical, traditional Chinese medicines. But it was in a meta-analysis with not a high quality of the studies, but they recommended moderately.
So in my case, I have no experience about that disease, but the similar disease that they have some problems, music and dance, they feel the people feel better. And this is the point. So for me, sport, for me, physical exercise, it's when people is having fun, everything will be best. So if you see people they are arriving on the finish line, they have no a pain face, they have like a smile face, which is, they are very in a hard situation, but the smile, it's important. So having a good experience, like dancing and music, if you like, they adjust. And also if they are doing this kind of exercise with the loved ones, so family, relatives, and friends. And there are different techniques that helps to you to keep your nervous system in balance. So that's important to the pressure and the concentration. And, yeah.
I think this concludes our program for the afternoon. Next, I would like to thank you to the panelists.